Opioid Summit was conducted in conjunction with the Missouri Department of Health and Senior Services. They also conducted several regional opioid summits across the state of Missouri in 2017. And for Columbia's summit, this allowed our partners and local stakeholders in central Missouri from different fields, education, law enforcement, local state government, to come together and learn more about the epidemic from different aspects through our different speakers, and then be able to start that conversation of how do we deal with this as a community, because it will take working from multiple different sectors and different avenues to solve.
No matter how you cut it, opioid addiction and overdose and abuse is a national emergency, it's a statewide crisis, and right here it's a local epidemic.
I was proud and also saddened to see an overflow crowd here at this opioid summit. I mean, we have over 300 participants here, but it's the data that is really compelling to me, that I think we were all surprised to see the number of opioid overdoses has now exceeded traffic fatalities in the state of Missouri and across the country. The council has already taken several small steps. We've joined a local PDMP, a prescription drug monitoring program, but we learned today we need to get more providers enrolled in that program to participate. We've equipped our first responders with Narcan. We've decriminalized the reporting, and I think the next step here is to really focus on prevention and make sure that everybody has the tools and the lessons learned from today to put into practice.
So at the summit, we had a personal perspective from a father who had lost a son due to drug overdose.
Let's start educating our children at an early age about mental health issues, what anxiety is, what depression is, and then let's teach them what type of coping skills we need to have to be able to endure that.
We also had the state of opioids, kind of looking at it from a research perspective.
Many of these people's first experience with an opiate was from a physician, usually a broken bone or pain in the back or whatever.
There are a much larger group of providers who are misusing, abusing, or diverting drugs. And so we think we're developing the capability to identify those providers proactively and then take action, whether that's through the DEA or the Missouri Healing Arts Board.
Over the years that have convened Heroin Now, the average purity rate, heroin itself being sold at street level dosage is 45%. It is not uncommon to see it at 90% purity. Now this is by street level distributors. That tells you what an overwhelming supply we have. There is no way for a traditional drug user, someone using cocaine, marijuana, methamphetamine, we're purchasing those substances believing that that's what is inside. There's any way of knowing that there's fentanyl mixed in with that. We want to stop the large shipments of heroin and fentanyl, and all drugs for that matter, before they get into the U.S. That means trying to stop them south of our border. Safer communities are brought about by effective and correct law enforcement. That's what we're in the business to do, is to make communities safer.
The last half of our summit, we looked at prevention. So what can we do going forward? What are some ways that we can combat the opioid epidemic?
As we've heard throughout the day, in Missouri specifically, last year we lost 908 people to fatal opioid overdose. This is like 2 to 3 people a day, and this was a 35% increase from the year before.
It can be really difficult, especially when we frequently hear about people who have passed or people who didn't have access to care. But for every one of those, I'm lucky to be in a position where I run programs and grants where I hear about the positive outcomes of our work. So I'm inspired to use the funds that we're lucky enough to have to do good work, to get people access to effective treatment, to save lives through naloxone, to provide training and education. And that's really motivational and uplifting, because we hear testimony and we see firsthand that it's working, that these efforts work. They save lives, they improve functioning and increase meaning. And those are the stories that get me out of bed in the morning, because we gotta do this work.